All right, everyone. Good morning. Today is Thursday, April 27th, and we're very excited to have all of our wonderful partners on this call. And we're going to jump right in. We have a pretty exciting program for us today. A couple of guest speakers here from the County Health Department, and let's go ahead and jump right in. All right, just covering some of our agenda items for today. We'll start with some brief announcements. We'll revisit the Not Alone initiative. We will also share some information about addiction and harm reduction, a workshop opportunity about school bullying. We'll proceed with our COVID-19 update. And then we also have a mini presentation on HIV and STI resources here through Pima County Health Department. And then we'll finalize as usual with a Q&A in the chat. All right, so a bunch of announcements today. So some of our usuals, Narcan is available for schools. If you're interested in this reversal drug for opioid-related overdose, you can reach out to school support at pima.gov. We also have available here through the health department presentations on fentanyl for staff, youth, and families. We also have COVID test kits available, and those are available for pickup here at our warehouse. As we do after these presentations, we'll send out this PowerPoint. So you'll see a varying degree of different links throughout, and those links will be accessible to you in the PDF attachment that is sent to you. But that test kit link to request those is included here. You can also schedule an on-site COVID-19 vaccination clinic at your school for staff, students, and family. And so to do so, all you have to do is contact our vaccine equity program at vaccineequityscheduling@pima.gov. We're very excited to share with you that the Pima County website has been updated. So if you haven't been to our website recently, in the last week or so, we encourage you to go explore it, look at the new layout, the new format. And so just as these changes can occur. You may have bookmarked links, and some of those may not work. And so there may be some growing pains there, but we're here to help. So if you need help navigating to a resource, please do email us at that school support email above. If you are interested in epinephrine, or you have like stock EpiPens expiring, need assistance with standing orders or acquiring medication, we may be able to help. So similarly, email us at school support. And then in the same vein, if you're interested in wall mounts for stock naloxone at your school, we may have some funds available if your school site is interested. Again, email us at schoolsupports@pima.gov. As usual, we continue to offer emotional wellness presentations for staff and students. These presentations can be modified to meet the needs of the school. They're typically 1 hour in length. If you have your smartphone, you can scan this QR code. Once you go to that link through the QR code, you'll see that there are topics including practicing mindfulness, managing stress, trauma-informed care, PACS tools, and Text Talk Act. And there are associated descriptions with each of those and a breakdown as to what presentations can be just for staff, what can be for students, or combined. Pima County is excited to again share with you information about the Not Alone initiative. And so this is a mental health initiative targeting youth and staff in K through 12 settings who have tested positive for COVID-19 since May 1st of 2021. There are two prongs to this. One is linking young people and staff who have tested positive for COVID-19 since May of 2021 to brief intervention services. We're very proud to be partnering with Cope Community Services as the servicing agency for this. One small piece I'll share about that is through this partnership, we've ensured that whether or not a young person or a staff person has tested positive for COVID-19, COPE has many continuums of care. And so anyone who engages with this initiative will be engaged in some type of services. And so we're very excited about the comprehensive nature of this initiative. The second part of the Not Alone initiative is a peer-to-peer training through the Born This Way Foundation. And so they have a Be There certificate. It's entirely online, it's self-paced, it's free, and it's offered in 3 languages, English, Spanish, and French. If you're interested in learning more about Not Alone, potentially having these resources at your school, if you're in TUSD, you should probably expect to see those in all of the middle schools and high schools here soon, fingers crossed. And other districts, we continue to work and build that infrastructure as well. So please do reach out to us. We need champions in school sites to help us get this word out. You can email us at notalone@pima.gov. And then there are also digital outreach materials. So all physical and digital assets are available for free. I see that in the chat, Gretel. So there is a, when this is sent out, you will see that we have a Not Alone hub. So all English and Spanish materials, whether that's flyers, digital assets intended for social media, our video and audio recordings for various commercials that are playing on radio stations and movie theaters. All of those materials we've made free to community partners like you, so that you can be the best champions for this initiative as you work with young people every day. Again, if you're interested, please do reach out to us at notalone@pima.gov. All right, and so one of the announcements that we have today is Pima County Health Department is partnering with TPD to offer a presentation called Let's Talk About Addiction. And so we just invite folks who are interested in maybe signing up for this presentation for your organization or for you to reach us at cmha@pima.gov or at their phone number at 520-724-7470. This presentation is designed for teens and young adults, parents, teachers, professionals who encounter people who use substances, or anyone interested in learning about addiction. So really, this is for everybody. And so some of the topics that are included are very important, right? So we're talking about Narcan and fentanyl testing, kit distribution, substance use treatment options and interventions. We learn about overdose prevention and harm reduction. So harm reduction meaning any positive step to improve one's health. And then we also make sure everyone understands the impact of addiction on the brain and current data on overdose and drug trends in Pima County. Again, this is one of those issues that it takes the full community for us to get behind. And so again, if you're interested in signing up to attend one of these presentations or host it at your organization, please do email cmha@pima.gov or call them at 520-724-7470. All right, so now Kristen, I believe you're on the call. If you would like to jump on and take it away, tell us about your exciting training opportunity.
Thank you, Michael. Hi, everyone. My name is Kristen Spivak. I am a program coordinator with the maternal child health team here at the Pima County Health Department. And we this year have started focusing some of our efforts on engaging the community in education on best practices in youth bullying prevention. So there's a training that we're going to be offering on the dates that are on your screen there. So we have 4 trainings coming up in May. They're an hour long, where we're just going to be sharing some of the evidence-based information on current best practices. There's a lot of information out there that people are kind of working on. That's some old, outdated information, and we just want to share with you guys the newest information that's involving youth bullying prevention in schools. So we're really trying to engage anybody who works with youth. So not just educators in the classroom, but anyone who works on a school campus is really welcome to join these presentations. And if you guys share them with anyone that you think would benefit, like I said, they're free webinars. They're an hour long. We're going to be having a discussion, sharing some of the best practices, discussions about who's the most at-risk youth in your communities that you're working in, and then identifying some of the key stakeholders moving forward in youth bullying prevention within your schools. And then we'll be here to answer any questions that you guys might have and share some resources that we have available. So I will go ahead and send out the flyer along to Michael so that they can share it with you after the presentation. And then the links are going to be available on there for the registration. And I will also share my contact information in the chat here in case you guys have any questions. You guys can reach out to me as well.
Perfect. Thank you so much, Kristen. And
Thank you.
would you be able to, it sounds like there's a registration link. Would you be able to share that in the chat as well?
I can. There's going to be 4 different links for registration.
Yeah,
It's going to be through Teams. So I'll share those with the dates as well, so they'll be available to y'all.
amazing. Thank you so much. And
Thank you.
thank you for the awesome work that you and your team are doing.
Appreciate it. Thank you.
All right. So now I want to turn it over to a member of our EPI team. So Matthew, take it away. Thank you so much.
Yeah, good morning, Michael. Good morning, everybody. Yeah, just a quick COVID update. Fortunately, we've been still seeing some low level, community level specifically, so that's great news. Pima County is still experiencing a substantial rate of transmission. So we are looking at about 54 cases per 100,000, but it is about a 21% decrease from the last report. So good news there. Testing positivity is hovering around 5%. And again, it's decreased about a percentage from our last report. Approximately 24% of those 5 and older have received the updated bivalent booster, so that's good news. But we continue to recommend individuals get that updated bivalent booster if they're eligible. And again, this data will be updated later today. So if you check the CDC page, the numbers may be a little bit different. Next slide, please. All right. Again, similar to last week or last report, we're seeing a lot of green, so that's good news. Just some a little bit of red/orange color there and some yellows. As you can see, we do have a little bit of Arizona there in the medium level, but again, it's changing week by week. So hopefully we'll be in the green come later today. Next slide, please. Again, just like to remind everybody about how the CDC does calculate this community level. They're on the left on that chart. And again, we are seeing about 54 cases per 100,000 for Pima County. Additionally, we're seeing about 3.5 new COVID admissions per 100,000 population. And then around 1.5% of those inpatient beds are used with individuals that are confirmed COVID-19 cases. Next slide, please. And again, this nice, colorful graph here. It's hard to visually look at it. But as you can see, Pima County right there is in that substantial, and then a lot of counties around us are on that high level. So, again, we always caution our healthcare facilities. I know you guys aren't healthcare facilities, but about the mitigation that's recommended when we are at a high level, which is really that source control. But because again, that is changing every week. And as you'll see on the map, we do have one state there in the gray. As we move forward with the public health emergency ending, states may make decisions on whether they're going to report or what's going to be reportable, things like that. So again, this map may continue to get some gray that pops up. Just be aware of that, just because data may not be available to present. So that's why we're seeing that data like that. Next slide, please. And again, just like to remind everybody, there's multiple ways you can contact our team. epi@pima.gov is going to be a very quick way if you have something that you just want to ask quickly. But again, you can always call us. We have our wonderful CDIs, our communicable disease investigators that answer the phone between 8 and 5. So again, you can always call that and we'll triage your call if we have to go to voicemail. And again, we have our faxing option as well if you need to fax over a report or any data or information. Next slide, please.
All right. Thank you so much, Matt, and thank you to the EPI team for continuing to present on these calls and give that information in such a knowledgeable and succinct way. Very much appreciate that partnership within our department. All right, so before I introduce the next speaker here, I just wanted to bring to everyone's attention that every April, on April 10th, is National Youth HIV/AIDS Awareness Day. And so in this presentation, we want to bring some focus to some sexual health resources available through Pima County Health Department. Related specifically to HIV/AIDS, we know that 1 in 5 new HIV diagnosis in the United States occurs in young people aged 13 to 24. We also know that 6% of high school students have never been tested, or have only 6% have ever been tested for HIV, again, within that age range of 13 to 24. Some other key considerations are that condom use, for example, among sexually active students decreased from 60% in 2011 to 52% in 2021, presenting a serious health risk for HIV and other sexually transmitted infections. We also know that substance use can lead to high-risk behaviors, putting folks at risk for HIV transmission. When young people, or anyone for that matter, are under the influence of drugs or alcohol, they may engage in riskier behaviors that are high risk for HIV, such as sex without a condom or not taking medicine to prevent or treat HIV. We also know that there are health disparities within the youth population, and so some youth are at higher risk. Notably, lesbian, gay, bisexual, and questioning youth, LGBTQ plus youth, are at greater risk for negative health outcomes. 1 in 5 LGBTQ plus students experienced sexual violence in the past year, compared to 1 in 10 of their heterosexual classmates, and 21% of them were more likely to have ever used illegal drugs than their heterosexual peers. As we know in health, a lot of these things can cross over and create increased risk. We're looking to build some awareness in terms of youth HIV/AIDS in the United States. And so for our presentation today, we want to focus on HIV and STI prevention and surveillance, as well as our teen mobile outreach. And so now I want to turn it over to Noel. Noel, are you on the call? Hey, Noel, it's good to see
How
your
are you,
face.
Michael?
I'm doing very well. How's Teresa Lee Clinic today?
Bustling.
All right, Noel. So we have about 13 or so minutes. I know you're very quick, and I know you have a lot of information, so I'll turn it right over to you.
Morning, folks. My name's Noel Vaya. I'm Program Manager Prevention Services here for the Pima County Health Department, and I'm providing this presentation on behalf of my colleague and friend Desdemona Hartong, who is unavailable. She is at the HIV consortium up through sponsored by Arizona Department of Health Services up in Phoenix. So she asked me to give her a little plug on her programs that we provide here through the health department. Next slide, please, Michael. Thank you, sir. So this is the makeup of our lead staff for the HIV prevention and surveillance program. These folks, as you can see, there's managers here. There's also CDIs, which I'll talk about a little bit later in the presentation. They are communicable disease investigators. So all these folks are in charge of surveillance for STI, HIV transmission here in Pima County, and also prevention. Next slide, please. So these are our STI programs. We have the prevention team. That's the little mobile clinic that is running around town constantly providing outreach. And again, that'll be discussed in the future slides here. To prevent HIV, to provide testing and information and resources to our community. We also have an investigation and surveillance team, which is composed of communicable disease investigators, or better known across the United States as disease intervention specialists. The goal, again, is to spread the spread of disease by interviewing patients and contacts, providing partner services, education, and case analysis. Next slides, please. So where are our clinics at? Well, we have various clinics. We have 2 of them, our brick and mortars. They are at North Clinic, which is on First Avenue in Prince, and the Teresa Lee Clinic, which is at Midvale Park across from emissions testing here, which is Midvale and Valencia. Our services are offered at low or no cost. We provide testing and treatment for STIs, testing for HIV, and immunizations and well woman exams are also available here at our clinics. For any person that's symptomatic with an STI or HIV, we want them to see a clinician. And again, that's very important to be able to make a correct diagnosis. And if it is an STI, we can provide them with treatment. If a person does test positive for HIV, we are going to immediately link them to same day same day treatment. We're going to give them a 10-day supply of medications and automatically link them to HIV care with our partner agencies, either through El Rio or through Banner Health, the Peterson Clinic. So going back to our testing, it's walk-in, no appointment is necessary. And what we test for is chlamydia, gonorrhea, syphilis, and HIV. These are every Monday, Wednesday from 9 a.m. to 4 p.m. and Fridays from 9 a.m. to 2 p.m. at both these clinics, Teresa Lee and North. For PrEP initiation, where they can, patients who are interested in starting PrEP, PrEP is an antiretroviral medication that they can take prior to contracting HIV. And what this does is it helps reduce the risk of HIV infection amongst people who are who are at high risk for contracting HIV. And we also do referrals for PEP for persons that have possibly suspect they've been, oh my goodness, brain fart. They've been exposed to HIV. We want to get them in PEP, and we're also going to provide that 10-day regimen and also a referral to their PCP for follow-up. We also have a safe navigator who initiates this at North Clinic, Southern Arizona AIDS Foundation. We work with them on a rotating basis there at North to be able to help people access PrEP services and PEP services through both through El Rio and Banner Health. We also have clinical navigators or CDIs available at all our clinics. And the PEP referral, after they've been seen by a navigator, are referred to the clinician, and then that process begins at that point as well. Thank you, Michael. Next slide. So where do we do outreach and education? Well, this team, composed of about 8 folks, they conduct outreach and testing at bars. They do it at various locations in Tucson, up on Stone Avenue, 4th Avenue, testing after dark, at health fairs, at community events when they're invited to those, and especially around public health campaigns when, National AIDS Day, National Latino AIDS Awareness Day, Native American Awareness Day, and other events that showcase the importance of knowing someone's status. Pima County Health Department, we also provide that there at our various clinics. We also provide the rapid HIV and syphilis testing, our urine and swab testing for chlamydia and gonorrhea, pregnancy testing, and blood draws for all confirmation and additional screening. So if a person does a rapid test, which is basically a finger prick, 15, 20-minute process, if the person tests positive, we're going to automatically do a confirmation, because there are occasions, and it's very, very rare, but there is that chance that a person's immune system is acting funny. If a person is going through treatment for different types of cancer, or maybe has a possibility of a certain type of cancer, you're going to test positive for this, for HIV, which is alarming. So again, 2 for 1. An interesting fact, if a male tests positive on a pregnancy test, there's a high possibility that person may have prostate cancer. So just throwing some things out there that you learn while being in this field for a long time. That's why follow-up testing is very important. And that's why we always do confirmation blood draws for an initial positive, both for syphilis and HIV. Next slide, Michael. So we also provide the needle exchange program, LifePoint. This program's been around for over 25 years. Miguel Soto manages this program along with his prevention staff. It's basically a harm reduction model. We are not promoting illicit drug use and needle sharing. We are providing these supplies to reduce 2 things, hepatitis C and HIV. We provide clean supplies for these folks to safely inject themselves. We also provide wound care, medical screening and testing, and referrals for support and resources. At that clinic, we have individuals from COPE. If people want to enter into treatment, that's always readily available there. And I've seen it in person. And it's really neat to see somebody say, you know what, I'm done with this stuff. I am just done. I just want to get into treatment. And the person, COPE, is right there to give them a warm handoff, to get them into detox and to start that inpatient or outpatient process. And in this case, it was an inpatient process, which was wonderful. The hours of operation for this program are Mondays 9 a.m. to 12 at Teresa Lee, Tuesdays from 10 a.m. to 2 p.m. at our East Clinic, which is at Broadway and Kolb behind Brings Funeral Chapel and next to the barbecue restaurant there, good food. And also Fridays at North Clinic on First Avenue and Prince. Next screen, please. Partner services. So if someone, when we test and we find out through that test that they are positive for an STI or HIV, we are automatically going to try to get their partners in for testing and treatment. I think that that reduces the risk and spread of those folks to other people. Again, knowledge is power. Knowledge is the ability to make decisions to assist in the welfare of your health and others. And I think that that's something that this team is very, very skilled at and very good at interviewing and making people feel at ease when they find out that they may have been exposed. People freak out. And when people feel that they feel less than. And I think this team really does a good job of helping those folks through that process. Again, these are the various methods that they use to locate those folks, to test and treat the partners. And then also referral to psychosocial and other support services is applicable. Sometimes these folks are facing some really significant barriers. Maybe they're homeless. Maybe they are using sex for survival. I think that this team really does a great job. And again, I've worked with these folks for many years. And amazed at how many people they impact in a positive way through this brief interaction for an STI treatment. It opens up a world of opportunities for these folks that sometimes they're not aware of that are available in our community. Next slide, please. Reporting. The importance of getting these folks in for treatment is really important. It prevents outbreaks, folks. And again, if there is an uptick in our community for something that is STI related, we alert the community about that. And also, you know, at places, especially if we're seeing these outbreaks at certain areas where people are congregating, bars, social areas, we want to make people aware of that and provide, again, some information face-to-face or through flyer or social media to let people know that this is going on in our community. We also encourage physicians to refer positive patients to the health department for partner services and treatment. Sometimes physicians at a primary care facility find out names, they refer that to the health department as well, so we can track them and get them into treatment and care. Next slide, please. So these are the diseases that we concentrate on here within the health department within the clinical services program, HIV, syphilis, gonorrhea, and chlamydia. Right now, folks, I just want to give you a statistic that just came out yesterday, and I was alerted to this. Arizona ranks 10th in chlamydia out of the 50 states, and this is post-pandemic. The most recent survey that was done, I think, about 4 months ago. Also, we rank 8th in gonorrhea, and we rank number 2 in neonatal syphilis, congenital syphilis, where mothers who are pregnant have contracted syphilis, and that is very alarming. So again, media push has been done, is being ongoing right now to try and alert people of the risks. So if people, older folks, middle-aged folks, and adolescents, we're encouraging them, if they are sexually active, to please get tested. Next slide, please. All right. Desdemona Hartung, I can put her email in the chat a little bit later. It'll alert you folks. I'll put her contact information in case you have any questions regarding her program and the services that they provide. And that will be available to you as soon as I get through with this presentation, okay? I also want to let you know about the Teen Mobile program that I oversee. These are the 2 mobile clinics that we have. The one on your left with the names of my staff there, that one is 26 years old. That reliable. We nicknamed it Randy. That sucker is reliable as all get out. Runs like a champ. The new one we call Chucky, which is on the right hand. That thing is possessed. I am getting ready to get my certification in exorcism through the Vatican. So we're going to work on that mobile and see if we can get that. No, just joking. They both are wonderful. They provide ongoing services to our community. I have a great team. And so very blessed to have them. Go ahead, next slide. This gives you a picture of what it looks like inside. It's a full-blown clinic on wheels, 35 foot long. One is 36 feet. The new one is 35 feet, full-blown clinic. We can do testing there. We can do blood draws. There's an exam room, as you can see in the bottom left picture, where the clinician can examine and provide things like IUD insertions, PAPs. Those are readily available on our mobile clinic as well for adults and teens. Go ahead, sir. So what we provide, first and foremost, this program's been around for 23 years, 25 years in different capacities. It started off working with homeless youth and expanded to different school districts, Sunnyside School District, and then various charter high schools, one outpatient substance abuse program, and finally with Tucson Unified School District. We provide this service on their campuses Monday through Friday at low cost or free, basically, to these teenagers. And what we provide is comprehensive reproductive health education and services and information to youth. You would not be surprised how many kids come to us who are abstinent, and after reviewing and getting health education from my team, they remain abstinent. They're like, oh no, I'm not ready for this big decision. And I think that's wonderful. But again, we give them information so that when they are ready to become sexually active, they delay that sexual activity. They are more they're more able to make smarter choices. And I think that's wonderful. And again, through Title 10, we are mandated to provide abstinence education as well. So I think that that's wonderful that we are comprehensive in our approach to providing these services to adults and teens. For the teen mobile, we provide these services. We provide STI testing, which includes HIV and syphilis testing, birth control, various types of birth control, which include IUDs as well. We also provide condoms and Plan B, which is emergency contraception in case young people have made poor choices. Again, Michael talked about people being under the influence of substances or alcohol and engaging in high risk unprotected sex. So that is available as well. Interesting, through Title 10, because it is federal law that has been enacted since 1973. All people of reproductive age have the capacity to access reproductive health care and services, and parental involvement is encouraged, but the services don't require parental permission. I deal with upset parents, and I understand, as a parent of 4 female teenage youth, I get that. I understand. I totally respect that. And I guess what I'm trying to say is that we don't promote a sexual activity. What we do is we provide these services for those teens that have already become sexually active to, again, delay having an unplanned pregnancy, prevent them from contracting an STI, and also delaying the time that they want to become to start a family. I think that they understand that with time and education and experience, they realize I'm not ready yet to start having children. And I think that this provides that valuable resource and service to these folks. Next slide, sir. So this is the various types of STI testing. As you can see here, we have urine samples where they pee in a cup, throat swabs that are self-administered by themselves, and then blood draws. And again, these are the different types of birth controls that we provide on our mobile clinic. Next slide, sir. These are where we're located, within the Sunnyside Unified School District at all 3 of their high schools, within 5 of the 13 high schools in Tucson Unified School District, and 5 charter high schools, including 1 outpatient substance abuse program for adolescents here in Pima County. Next slide, sir. So highlights from August to March of this year, we have provided 85 high school mobile clinics. We've provided services to 479 students, 321 STI, which includes HIV and syphilis test screenings, and 263 pregnancy tests. We also have a community mobile, which I will post the link here. And that is the community mobile that is provided at various libraries. We have a rack card, folks, and because of the recent renovation of our website, I have to destroy all these rack cards and the electronic copy because they do not no longer link. So I'm just giving you the direct link to the mobile clinic, and it gives you this month's schedule and next month's schedule, and that's going to be ongoing for the remainder of this program at the community mobile clinic. And again, we provide various services in collaboration with the Health Department Vaccine Equity Program. We provide COVID-19 vaccines and flu immunizations. Family planning is available, STI, HIV testing, COVID test kits, guys, and feminine product dispersal as well. So that's ongoing on the second and fourth Fridays of every month from 12 to 4. Again, that link will give you that information for all community members, adults and teens to access our services all around town. So if you're not able to make it to our brick and mortars, you can come to the community mobile clinic, okay? We've also tested the U of A. We've had a wonderful collaboration with Campus Health for the last decade. Post-pandemic, we're not seeing the numbers at those events where we tested health fairs. But again, we've been very grateful to provide 2 campus health fairs, testing events with 82 students. And we also provide a lot of outreach at the schools during lunch. So we do lunch and learns. We have a game where they play. We provide outreach on our mobile or brick and mortar clinics to promote our services through clinical services. And we provided that to 137 students. Next slide, please. So we also do a lot of health education presentations regarding healthy relationships, avoiding coercion from partners, and also STI and reproductive health information. If you'd like us to possibly host a mobile clinic at your school, folks, at your organization, please contact myself or my lead, Michelle Magañas. She's my lead student support specialist on the mobile. Please reach out to us. Here's our contact information. And we look forward to talking to you and answering any questions you may have. And again, thank you folks for your time. I'm a little bit over, I'm sorry, Michael, but just a lot of information to go through. And again, folks, thanks for your time. Appreciate it. And Michael, I'll turn it over to you. Thanks again, Michael, for helping me. Appreciate it very much, sir.
Thank you so much. And that is perfectly fine that we went over. We'll be ending here shortly, but I think all of the information is so important, and just really appreciate how comprehensive you were. And hopefully folks are leaving today having learned a few things about how to link young folks in our community to make sure that they have the resources to make the best, most informed decisions, especially when we're talking about engaging in some of those riskier behaviors that might put them at risk. So let's just go ahead and move to finish up today. So some of those resources here throughout the presentation, how to schedule a COVID-19 vaccine clinic, other COVID resources for schools. We've included the Not Alone main page, as well as the toolkit, so that Not Alone hub. Again, you can always email us at notalone@pima.gov for that youth mental health initiative that we're working hard on. If you'd like to request COVID-19 test kits, we have that link provided here. And then I've also included from the CDC. They also have a toolkit for youth HIV/AIDS health promotion. So I know there's a lot of folks on this call who work in nurses' offices throughout our school districts in Pima County. And so there's a number of resources that are printable and you could hang up in your space where students come to see you. The next school's call will occur not next week. I don't know why it says that, but in 2 weeks, Thursday, May 11th at 9 a.m. We have moved to a bi-weekly schedule, so meeting on the first and third Thursdays of each month, though you can reach us anytime at schoolsupport@pima.gov or Monday through Friday at our school phone support at 520-724-7018. And again, those web addresses, emails, and contact information are available there for you. All right, so now I'm not seeing any questions in the chat, but yeah, I'll give a moment or two here to see if we have any questions for our presenters or anything health related that we might be able to help answer. All right, I'm not seeing anything in the chat. I want to put a special thanks out to folks who presented on the call today. Thank you, Noel, for that, the presentation that you gave. We encourage folks to sign up for the different opportunities that we shared with you today, and we will follow up in email with all of the information presented. You can also access this recording on our school support, Pima School Support YouTube channel. Every single one of these meetings are posted there, so if you ever want to go back and watch, we encourage you to do so. Share this with colleagues who maybe are not able to make it on this call. And if you think that someone should be on this call that is not, feel free to connect us at that school support at pima.gov, and we'd be happy to add them to the calendar invite for this meeting. Without any questions in the chat, we wish all of you a fabulous day, and we'll see you in 2 weeks. Thank you so much.